Well, I would want to see ideally a highly targeted therapy, okay, similar to the FLT3 and the IDH1, IDH2. Now, we know that those monotherapy, targeted therapies may not work in all individuals. You know, for IDH2 patients that have a known mutation IDH2, only about 40% are going to have some clinical response. So in addition to developing targeted therapies, I think that they should also be looking at identifying biological markers that we're going to predict which of the 100 patients are going to respond to the targeted therapy. I think that's essential. I also think toxicity is an issue, and as you said, the frail patients, I think oral formulations are great. Patients find that the quality of life is really improved if they don't have to come into clinic 7 days in a row, and their tolerability and their acceptance of those drugs, I think, is a little bit better. So I think we also need to look at duration of response. I think having a low-dose, non-toxic therapy targeted with correlative biomarkers to identify who's going to respond and who's not going to respond. Some of these agents take a long time to work. So we want to make sure that they work, and then we want to have a good sense of when to look for a response and how long that response is going to last, because we don't want to stop a therapy too soon and we haven't gotten a clinical response. But we also need to be aware that some of these therapies are not going to replace more durable therapies potentially for certain patients. So I think those are sort of my wish list: durability, targeting, selection. Those are things that I'm looking for.
What portion of your patients fall into this frail category?
So in my population, the median age of patients presenting with newly diagnosed AML is in the 67 to 70 range. So over half of my patients are going to be in that over 65, 70 age group. Those patients, there's a high variability. It's not necessarily an age-defined thing, comorbidities, functional status, etc. So I would say probably about half of my patients are not, I would say, ideal candidates for intensive chemotherapy for one reason or another.